this video, let us continue the June 9th Indian Express news articles in this part 2 of the video. At this rate, RBI leans harder to rein in inflation, but rebound in services will put upward pressure on prices. A fast forwarding of interest rate hikes was unavoidable because of 5 reasons. One was a confluence of factors has pushed inflation higher and made it persistent and broad-based. Say 2 is, even with this hike, repo rate, the signaling tool for banking interest rates, is still below the pre-pandemic levels. 3 is monetary policy impact growth and thereafter inflation with a lag. 5 is aggressive stance of US Federal Reserve and ensuing tightening financial conditions. India is better placed today than in 2013 to face the Fed's action with a stronger forex shield. Next article that we are moving into is related to signs of ill health. What this article talks about is we need to make public health a center focus towards much needed badly delayed institutional reforms. To the state established Ministry of Health has issued guidelines to states to establish a public health cadre. Ideas ranged from instituting a central public health management cadres like IAS to access, manage and control the public health problems to adopting an institutional approach to diverse the public health concerns from health cities enforcing road safety to immunizing newborns, treating infectious diseases and promoting wellness. Process of reforming to create a public health centered primary healthcare system. Clearly the 3-tier model of subcenters with paramedics, primary health centers with MBBS doctors and community health centers with 4 to 6 specialists has failed. Why, one might ask? The model's weakness is the absence of accountability framework. The facilities are designed to be passive, treating those seeking care. Instead, like in Brazil, we need family health teams accountable for health and well-being of dedicated population, say 2000 families. Family health teams must consist of doctors with a diploma in medicine and a dozen trained personnel to reflect the skill base required for the 12 guaranteed service under Ayushman Bharat scheme. The team ensures a continuum of care by taking the family as an unit and ensuring its well-being over a period, nudging these families to adopt lifestyle changes, follow upon referral for medical intervention, and post-operative care through home visit for nursing and physiotherapy services would be their mandate. Their works should be closely monitored and the personnel should be given outcome-linked monetary and non-monetary incentives. Currently, public health, family medicine and public health management are used interchangeably. They should not be just a cardiology and neurology should not be used interchangeably, though both clinical disciplines. Family medicine is a clinical arm of the public health. MBBS doctors go through 2-year training in family medicine, specializing in disease control and communicable and non-communicable diseases. Alongside, India needs to move beyond the doctor-led system and paramedicalize several functions instead of wasting gynecologists in CHC, common health centers, when there is an overall shortage of them. Midwives, nurses with a BSc degree and 2 years of training in midwifery can provide an equally good service except surgical and can be positioned in all common health centers and PHCs. This will help reduce C-sections, maternal and internal mortality and out-of-pocket expenses. Bringing such a transformative health system will require a comprehensive review of the existing training institutions, standardizing curricula and qualifying criteria. Next article that we are moving into is related to what's in the draft IT rules withdrawn and re-released. Ministry of Electronics and IT has published a fresh draft of amendments to Information Technology Rules 2021, which proposes the creation of government-appointed appeal committee that will be able to veto the content moderation decisions taken by social media intermediaries such as Facebook, Twitter, and YouTube. The proposed changes are: the draft proposes to create the central government create the government appointed appeal committee that will be empowered to review the possibly reverse content moderation decisions taken by social media companies. What it means is that if a user is not satisfied with the content moderation decision taken by the company's grievance officer, they can appeal before the proposed government's appointed appeal committee. Every order passed by grievance appellate committee shall be compiled with a by the concerned intermediary. The draft says currently only recourse a user has against company's content decision is to approach the court. The new proposal also suggests placing additional responsibilities on grievance officers appointed by social media companies. It says that if a user complains about the content which is patently false, infringes the copyrights and threatens the integrity of India and among other things, grievance officer will have to expeditiously address this. It's within 72 hours under the current rules. Grievance officers have to do so in 15 days. The concerns are the proposal to set up the government appointed committee was triggered concerns about the government overriding social media platforms content decisions. Reacting to the proposals in the last draft, the proposal without any legislative basis seeks to subject content on social media to direct scrutiny of the government by permitting the users to appeal decisions of the social media platform to grievance appellate committee constituted by Ministry of Information and Technology. Next article that we are moving into is related to science behind the cancer cure and therapies future in India. The article talks about 12 patients in US were completely cured of rectal cancer without requiring any surgery or chemotherapy. The trial used a monoclonal antibody called dostarlimab every 3 weeks of 6 months for the treatment of particular kind of stage 2 or 3 rectal cancers. The trial showed that immunotherapy alone without any chemotherapy, radiotherapy or surgery that have been staples of cancer treatment. What kind of deficiency is this? How was it cured? Mismatch repair deficient cancer is most common among colorectal as gastrointestinal and endometrial cancer. The patients suffering from these conditions lack the genes to correct the typos in the DNAs that occur naturally which cells make copies. Immunotherapy used what are called PD-1 blockades, which are now recommended for the treatment of such cancer rather than chemotherapy or radiotherapy. PD-1 is a type of protein that regulates certain functions of the immune system, including by suppressing T cell activity, which can sometimes keep the T cells from killing the cancer cells. By giving the PD-1 blockade, we release the brakes and allow the T cells to destroy the cancerous growth. How much does immunotherapy cost? Means immunotherapy can cost around 4 lakh per month, with the patients needing the treatment for 6 months to a year. We usually end up giving treatment only to those who can bank on schemes such as CGHS for sponsoring their treatment or receive free doses from the companies as a part of their assistance program. The future of cancer treatment is a molecular oncology. You find a mutation is in one gene, you give a particular medicine for it, you find it another, you give another medicine. Next article is Russia Turkey again back Ukraine grain export plan but wants sanction offer. The creation of safe maritime corridor in the Black Sea so Ukraine can export grains to global market amid a escalating world food crisis. Russia has expressed support for the creation of a safe corridor at sea that would allow Ukraine to resume the grain shipments. Under the proposal, Ukraine would have to remove its mines from the water near the Black Sea port of Odessa, and Russia would be allowed to check the incoming vessels for weapons. Next article talks about world's most detailed map of moon released. High resolution topographic map based on data from China's lunar exploration Chang'e project and other data from international organization. Next article is related to at 7% price rise likely to keep pinching still September RBI. The RBI's medium-term target for consumer price index inflation is 4%, with a band of plus or minus 2%. Unveiling the bi-monthly policy review, the Monetary Policy Committee of RBI has projected an inflation of 7.5% in June quarter and 7.4% in the September quarter. In a bid to further facilitate recurring payments like subscription, education fee for larger value under framework, the RBI has enhanced the card limit from 5,000 to 15,000 per transaction. Next article is related to how had European Commission proposed. In the last year, the European Commission had proposed a USB-C to be the common charging port to allow the consumers to charge their device with the same USB-C charger regardless of the device brand. It also proposed unbundling the sale of the charger from the sale of electronic devices to limit the number of unwanted chargers purchased or left unused. The proposal, however, only covers wired chargers and excludes the wireless charging from its ambit, meaning that only if a device uses a cable to be charged will it needs to have USB-C port. In case the device is only to be charged wirelessly, there is no compulsion to have USB-C port in the device. What was this proposal made? Consumers in European Union own around 3 mobile phone chargers, of which they use 2 on regular basis. That's all. If you like the video, please do share, like, comment and subscribe. Thank you.